We want to welcome Director Kriesman from the Veterans Administration main campus up in Ann Arbor, Michigan, for joining us today. She's just been doing a phenomenal job across a vast region that includes Toledo and our mother hospital at Ann Arbor for this VA facility. If some of you are not aware of that. So we want to thank you for joining us, and our purpose today is to talk about an act of Congress that was passed a year ago in August of 2022, and trying to bring information to veterans and their families about how to apply for this particular program. So in August of last year, Congress passed what is termed the PACT Act, but that actually was passed in honor of Sergeant First Class Heath Robinson, who had fought, and the act was named after him, promising to address comprehensive toxins that our veterans may have breathed in or been exposed to over many years. And he was an Ohio veteran. His wife, Danielle Robinson, along with his mother-in-law, Susan Zier, actually lobbied very hard as Buckeyes to pass a law that would finally be able to care for so many who fought in Iraq, in Afghanistan, in Iraq, the famous burn pits that were there, the infamous ones, I should say, those individuals who were present on 9/11, September 2001, September 11th, 2001, going back many decades, are available for assistance under this program. They all served our nation, and the PACT Act represents the largest expansion of veterans' benefits in our country in many, many decades. And there are millions of veterans across our country who have yet to file their claims, and that is one of the reasons for this press conference today. We want to keep reminding people what this new eligibility is and how they apply for it. So we estimate over 3 million veterans across our country who were exposed to burn pits or other toxic chemicals and substances can qualify for new benefits and care, and we are trying to find them. We are trying to make sure that they know themselves, their families, if they hear this information, to tell them this. They began being eligible for these benefits a year ago, in August of 2022, but August 9th of this year, next week, is the last day for affected veterans to submit what they call intent to file for benefits, to get backdated benefits to last year if they haven't already filed. So we want them to know that those benefits will not expire for them, but they need to apply by next Wednesday, August 9th. This is not an expiration of benefits for anyone, but rather a wake-up call to say, if you haven't applied, please apply, and don't forget the benefits that were owed to you going back a year. You must submit your intent to file by this August 9th of next week. Now, under the PACT Act, previously denied a toxic exposure-related claim, someone who was denied before can file a new claim for the Veterans Administration to review. Active duty military personnel may also file a claim if they are within 180 days of discharge. So we hope for future dischargees there will be a check-off before they leave the military, so we don't have to go through this and try to find them after they've been discharged. It is also important to know that applying for PACT Act benefits will not impact your current benefits. People don't have to worry about that. Veterans who currently receive compensation for a service-connected condition will not have their previously awarded claims readjusted simply because they file for new benefits under this PACT Act. Additionally, post-9/11 combat veterans, those who served after September 11, 2001, who were discharged over 10 years ago and are not enrolled in a VA healthcare plan must enroll by October 1st of this year to take advantage of the enrollment period. So we're also saying to veterans, if you haven't already enrolled, do so by October 1st of this year. Now, even if a veteran isn't experiencing symptoms of toxic exposure or hazardous substance exposure, or they don't know if they've been exposed, here's what they should do. Contact their VA service officer in the county in which they live. The district that I represent covers the northern quarter of Ohio, and each county has a veteran service officer. That's where they should start, and it's free of charge to them. The people of Ohio bear those costs, but they don't have to listen to TV and hire all these expensive organizations that don't live here to take care of them. Their first port of call is their local veteran service officer in their home county. Usually you can find them if they call the county commissioner's office, if they don't know where that building is. And they can enroll in VA health care today. We know that servicemen and women of our country have put their lives on the line for our nation and have carried liberty's mantle, and we want to show them the respect and the honor they deserve. And the PACT Act delivers on that duty. Now, applying for PACT Act benefits is free, it's easy, and you can do it, as I say, by working directly with the Veteran Service Officer in your home county, or you can come here to the VA or ask a veterans organization. Thank you for doing all you can to make eligible veterans aware of these benefits and also these filing deadlines. And for additional information, and we give this for the press, we would kindly ask you to put this up on the screen if you could when you file your story at va.gov/PACT or call 1-800-698-2411. Now, let me please call on the director of the Ann Arbor Veterans Center, Dr. Ginny Kreisman, Director Kreisman, who travels. Tell us the whole region you travel. We're just so honored to have you here today, and we know you had to make extra arrangements in order to be here. Thank you so very much.
Thank you, ma'am. I just want to thank Congresswoman Kaptur for arranging this event today. She's a strong advocate for the veterans care that we provide here, and I can always know that I can call upon her in support of our veterans. I've been in the VA for 32 years. And I love the VA. I love it for many reasons, but I love that every day I wake up, I know what my mission is. My mission is to serve veterans. When life gets a little rough, I just go down and help a veteran. Today, I'm here because I have an opportunity to serve more veterans. To reach, as Congresswoman Kaptur indicated, we're reaching out to more veterans than we have in 60 years. So I want to serve as many as I can. Those that can walk in, but I'm going to even put a strong call out to those nursing homes, skilled services, home-based care. Are you enrolling your veterans? Are you getting them in for a screening so they can possibly receive more services than they do now? Even those that have never had a relationship with the VA. So I want to give you just some information. Congresswoman Kaptur really provided us with a lot of overview, but just some specifics for this area. So in VISN 10, which is our network of healthcare systems in Ohio, Indiana, and Michigan, in the past year alone, we have reached out to more than 340,000 veterans. Actually, of those, about 140,000 of them have actually went through the initial screening and a second screening for validation on whether they are able to receive additional benefits. I know that we provided care to a lot of those veterans already, but if there's an opportunity that we've missed somebody, that we can reach them, unlike before, I'm here, we want to do that. So in our own area, which I serve veterans, our healthcare system serves veterans from Flint, Michigan, to Toledo, Ohio, to Jackson, Michigan, over to Canton, Michigan. That's a pretty large area. We have already provided services for about 37,000 veterans, and of them, about 14,000 have qualified for a second screening. So we continue to work on that. I want you to come in. I want you to come and see a veteran service organization. your Veterans County organization, the VA, and just take that time to see if you're eligible for additional services. We want to make sure you're getting the health care you need as a result of how you might have served in your military services. I also want to just take this time, there are great people here. They want to provide you the services. They will welcome you to the healthcare system. They will welcome you into just a different way of receiving the care that you need, whether it be from a healthcare perspective to maybe a social need. Maybe you need transportation, maybe you need homeless services, or just, food assistance. We're here to provide that service. That's what I love about working for the VA. We don't look just at the healthcare, we look at the whole individual. So the PACT Act, as Congresswoman Kaptur indicated, up to August 9th, we are able to provide, if you come in and register before August 9th and you're eligible for care, we can do that retroactive to August 8th of 2022. After that, it's just moving forward, but please come in. Please be part of this process. Please take the opportunity to see. If you don't ask, the answer is always no. So please take that opportunity. I know of veterans who have I actually spent a day on a weekend walking through the healthcare system up in Ann Arbor, and noted a family member who came on behalf of her veteran who was having some significant health issues. And she was just asking for an opportunity to be considered now because they were going through a rough time. I don't want anybody to get to that point. I want them to have the services before they get to that point. So please, if you have an opportunity, bring your veteran in, even if they've been told no before. The Congress, our leadership has provided this opportunity to reach you in spaces that we haven't been able to before. So please come forward. Please be part of that process. Let us provide that service. Let us, like I said, even if the answer is no, if you didn't ask the question, it would always be no. So I really appreciate everybody that comes here. I appreciate the employees here that are just totally committed to our veteran population, that are willing to be available and provide services. I appreciate our county service officers, our VSOs, our congressional representatives, all of us that are trying to get the word out to make sure that we're reaching every veteran that we can to meet their needs. Anything else?
Doctor, don't leave yet. I want to ask a question and we'll open it for questions here. But you mentioned of the tens of thousands of individuals that have currently been screened, you said it was 14,000?
So of the 37,000 that we've screened in my facility, just in this region that we've talked about, 15,000 of them have qualified for a second review, which means they've met the initial qualification and now they can be considered.
Could you, for the sake of the press that's here, describe the types of illnesses that have onset because of service in the military and exposure to toxins of various kinds?
So there are just a couple I can bring up that I'm fairly confident with. Is first of all, it's just breathing. The ability to breathe, to have that injury that's been caused to your lung as a result of inhaling toxins that are not appropriate. We can provide those services for asthma, for COPD, which is a chronic obstructive pulmonary disease. All those issues we can provide. But the other one is cancer care. And cancer care can be within you and it can be in your family members. And we want to make sure that we're meeting your needs, because it's very expensive in the community, it's very expensive in general, but if we have a chance to opportunity to provide those services to you, it'll be a great experience because we will take the best care we can of you, but it'll also be better for your family. We have a lot of wraparound services that allows you to support. So let me give you an example. If you're a veteran from Toledo who is getting cancer care and needs to go to Ann Arbor, we have a Fisher House. What is a Fisher House? A Fisher House is like a 3 to 4, maybe 5-star hotel where we'll put your family member in so that they can be available and close to you. So that while you're getting treatment, we're there to support you. And we're there to provide you services in the community. So those are just a couple I can think of that are really off the bat. There's also maybe dermatology or issues of the skin that have an impact, and maybe probably some GI issues. So, but the two I think of right off the top are those which are breathing issues and cancer issues. But even if you don't have symptoms today, please come in and get evaluated, because you don't know what the future brings, and we could be available for you.
Thank you so much. Does anyone have a question? No? That's pretty unusual. I will say in our region, we're such a hard-working region, just like the folks in Michigan in the industrial field, and we have a higher number of cancers here and a higher number of pulmonary conditions because people sometimes can't see it. Recently we've had the wildfires from Canada, right? And you can see the smoke, so you could actually see it, but you ingest it. And people don't think about their service in the military as having some of those threats, really. We're learning better whether you're a firefighter that didn't used to wear a mask or you didn't have your own mask. We have so many pulmonary conditions that attend to our firefighters in our nation. Now we understand that. Now we're manufacturing a different type of mask, but many of these types of injuries that people have were unseen. It's not like having a bullet. You can see that. These are more sneaky, and they require examination and testing, and we can do so much to help people. So I thank you very much. Did you want to add something, Doctor?
You know, the other thing too is I want to reach out to our female veterans. Often don't think that their roles or have a lot of history with their military time. We need to see our female veterans. We have the opportunity to provide service to them that's not available in the community, and we do it better than the community. So if you're a female veteran and you're asking yourself, why should I come in? Why do I go to the VA? I'm challenging you to take that first step, because this is an opportunity for you to get services, and you might have been exposed and don't know of it. So all my veterans, but my female veterans in particular, please reach out.
Thank you so very, very much, and thank you all for being with us today. Thank you for helping us get the word out on the PACT Act and how people can apply. Thank you.